Have you ever felt like your internal fire alarm is stuck? You are sitting on the couch watching a movie, but your heart is racing. Your shoulders are tight. You are constantly on edge. You know logically that you are safe, that there is no tiger in the living room, but your body is acting like you are being hunted. In my 30 years of clinical work, I have seen thousands of people living in this state. They are told they have anxiety or just chronic stress. They are told to breathe more, or they are given a pill to numb the feeling. But here is the contrarian truth. Your body is not broken. Your brain is not bad. Your body is simply stuck in a loop. It is a biological feedback cycle that has forgotten how to turn itself off. Today, I want to talk about how we help patients break that loop. I am Dr. Padda, and at painmd.tv, we do not treat pain or anxiety as just a diagnosis. We treat them as a signal. We fix the terrain. We are talking about the stellate ganglion block, or SGB. First, let's get the scary stuff out of the way. When people hear the words needle in the neck, they get nervous. That makes sense. But let's look at the science. You have a nerve highway running down the side of your neck. It's called the cervical sympathetic trunk. Think of this as the main fight or flight cable. It carries signals from your brain to your body to tell you to run, fight, or hide. It is there to keep you alive. But for many people, after trauma or chronic illness or long-term neuromuscular pain, that cable gets stuck in the on position. The SGB is a simple, precise, and deeply effective way to hit the reset button. We use a local numbing medicine, the same kind your dentist uses, and we place a tiny amount right next to that nerve highway. We are not cutting anything. We are not damaging anything. We are essentially putting the nerve to sleep for a few hours. And in that time, the nervous system stops sending those panic signals. It gives your brain a moment to realize, oh wait, everything is actually okay. Now, here is where we differentiate ourselves at our clinic here in St. Louis next to the airport. If you look online, you will find people who perform this procedure by just touching the neck and guessing where to go. They call it palpation guided. I call it unacceptable. We use live ultrasound guidance for every single patient. Why? Because your anatomy is not a textbook diagram. Every person's blood vessels and nerves are in slightly different spots. Using ultrasound allows us to see exactly where we are, avoid the blood vessels, and place the medicine with surgical precision. If a doctor is doing this without a screen, do not let them do it. Period. It is not about saving a few dollars. It is about your safety and the success of the treatment. So, what actually happens inside your cells? Think of your nerves like a series of gates. Information travels down the nerve, hits a gate, and passes to the next one. When you are stuck in a fight or flight loop, these gates get sloppy. They open when they should close. They close when they should open. The signal gets jammed. When we place that numbing medicine around the nerve, we are clearing the jam. We are helping the nerve gates reset their timing. After the procedure, you might feel a little out of it for an hour or two. You might have a red eye or a stuffy nose on one side. That is actually good. It is the sign that the block is working. By the next day, most of our patients tell us the same thing. I finally feel like me again. The racing heart slows down. The neuromuscular tension in the shoulders starts to let go. The world stops feeling like a constant threat. Does this cure anxiety? No. I am very clear about that with my patients. It is not a cure. It is a tool. If you are trying to learn how to swim, you need a life vest to keep you afloat while you practice your strokes. The SGB is that life vest. It creates a calm, safe environment in your body so you can do the deeper work of therapy or exercise or healing your metabolic health. At painmd.tv, we have patients who come from all over for this. They come because we don't just do the procedure and send you away. We are an interventional pain center. We understand how your nervous system connects to your joints, your muscles, and your metabolism. We use the SGB to quiet the storm, so we can go in and actually fix the damage. Think about it. If your joint hurts, you are probably guarding it. That guarding creates neuromuscular tension. That tension keeps your sympathetic nervous system on high alert. That high alert keeps you in pain. It is a circle. The SGB breaks the circle. If you are living in a state of constant low-level panic, or if you have chronic pain that just will not let up, I want you to know you are not crazy. Your body is just stuck. You don't need another pill to cover up the symptoms. You need a physician who is willing to look at the signal and provide the right intervention at the right time. If you are a veteran, a first responder, or anyone struggling with that stuck feeling, give our team a call. We have specific programs and a deep commitment to making this level of precision medicine accessible. We practice medicine differently here in St. Louis next to the airport. We are physician-led, data-driven, and outcome-focused. We don't believe in the assembly line model. We believe in fixing the terrain. Thank you for listening. If you found this helpful, share it with someone who might be struggling. And if you are ready to stop managing your symptoms and start fixing your health, we are ready to help. I'm Dr. Padda. See you next time.